Matthew Sharp, who has prepared answers to questions we tend to hear the most.
What does LASIK mean?
LASIK is short for laser in situ keratomileusis, which simply means to shape the cornea from within using a laser. In order for the eye to focus light clearly on the retina, the cornea must be of the proper curvature. If it's not, nearsightedness, farsightedness, or astigmatism can occur.
What exactly is nearsightedness?
When the cornea has too steep a curve, or the eye is too long in relation to its corneal curvature, images focus in front of the retina instead of on it. That's nearsightedness, and the result is you can see objects up close, but the distance vision is blurry.
What is farsightedness?
Farsightedness occurs when the cornea is too flat or the eye is too short. This causes images to be focused at a point beyond the retina. If you're farsighted, you have difficulty seeing objects both up close and at a distance.
What is astigmatism?
If the cornea is shaped like a football, more curved along one direction compared to the other, then images bend in such a way as to create no single point of focus. That's called regular astigmatism, and it results in blurry and often distorted vision.
How do I know whether laser vision correction is right for me?
Before the procedure, you need a thorough evaluation of your eyes to determine if you're a candidate.
What happens during the LASIK procedure?
Here's how it works. LASIK is actually a two-step process. In the first step, the surgeon creates a flap of corneal tissue and prepares the eye for making the appropriate correction. If treating nearsightedness, the laser removes tissue from the center of the cornea, making it flatter and reducing the focusing power. This moves the point of focus from in front of the retina to on the retina. If treating farsightedness, the cornea is made steeper as the laser removes tissue from the outer margins of the cornea. This helps the cornea bend light more and moves the point of focus from somewhere behind the retina to on the retina. If treating regular astigmatism, the laser removes tissue from the steeper meridian, thereby making the cornea more spherical or round. This allows light images to come to one point of focus on the retina. After the laser, which typically takes only 15 to 60 seconds, the corneal flap is simply replaced. Because corneal tissues have extraordinary bonding qualities, no stitches are needed.
What does all laser LASIK mean?
All laser LASIK has been proved to be the safest FDA-approved technology for creating the corneal flap. It can make the flap more precisely and accurately than the bladed method. In addition, individuals with thin corneas benefit from all laser LASIK because the laser method is better able to create a thinner flap. Additionally, the risk of flap complications has been shown to be smaller with all laser LASIK.
What is the difference between the LASIK procedure and PRK?
PRK is a form of laser vision correction that stands for photorefractive keratectomy. Unlike LASIK, PRK does not create a corneal flap. Instead, the top surface of the cornea is removed so that the laser can precisely reshape the curvature of the eye. PRK is often recommended for patients who have thinner than average corneas.
What is custom wavefront guided LASIK?
Custom wavefront guided LASIK uses light waves to measure subtle irregularities in each eye, called high-order aberrations, that may cause distortions in your vision. These measurements are then translated by computer to accurately guide the laser in reshaping your cornea for refined visual clarity and enhanced acuity at night. Your Lasikplus doctor will determine whether your individual vision characteristics make you a candidate for custom wavefront guided LASIK.
Will the procedure hurt?
The LASIK procedure itself is not painful. You may experience some minor discomfort for a few hours after the procedure. It may feel like your contacts have been in a little too long. On the day of your procedure, you'll arrive at your designated time. Eye drops will be used to numb your eyes, so there's never a need for any kind of injections. The entire procedure, from start to finish, takes only minutes. In fact, most patients are able to go back to work the very next day after their treatment.
How soon will I be able to see the difference?
The answer is immediately. Although your vision will be foggy, you'll be amazed when just moments after the procedure, you'll be able to see a clock on the wall across the room for the very first time in years. It's really exciting, and your eyes will continue to improve as they adjust to their new shape.
What happens after treatment?
After your procedure, we recommend that you go home and take a nap. When you wake up, you might experience some minor irritation or dry eyes. The eye drops will help alleviate this discomfort as you continue to use them over the next few days. Follow-up exams will be